Hey guys, Dr. Green here. In today's video, we're going to talk about the 10 most frequently asked questions that patients come into our clinic and ask us when they're considering the penile implant. This is just things that patients want to know, the most common things that we hear. So let's get right into the video. All right, so number one, how long does the implant last and what happens after it's broken or if it no longer works anymore? So we expect the implant to last about 12 to 15 years. Some studies have shown that actually 50% of devices are still working at 15 years. We tell everyone to expect about 12 years. At that point, there's about a 20% failure rate. So expect 12 years out of your implant. Be happy if you get more than that. There is a chance that the implant fails earlier than that. And just like any mechanical device, at 5 years, there's about a 5% failure rate. So it's pretty low. So we expect about 10 to 12 years out of them. After it fails, it's up to you what you want to do. If you want to get another implant, it's just another surgery. Similar to the first surgery, maybe even the recovery is maybe even a little bit easier just because you've been through it before. But if you don't want to get another one after that 10 to 12 years, if you're not having intercourse anymore, if you're not having sex, then you just leave it. It's not going to hurt anything to leave it in place. It won't bother you, but it just won't work. Another really important question that people come into clinic asking is, what are the complications associated with the surgery? Any surgery has complications. This one is no different. However, these complications are relatively minor, relatively low probability. The biggest ones, there's always pain, there's always bleeding, like with any surgery. The pain is usually very well managed with pain medications that we'll give you after the surgery. Bleeding, very low chance of bleeding. There's a very small incision. It's about 4 centimeters in length below the penis, between the penis and the scrotum. So it's a low chance of bleeding. The complication that we worry the most about is infection. Infection is about a 1% chance in a normal individual, about up to a 2% chance in a patient with diabetes, especially if the sugar is uncontrolled, but really about 1% chance. However, that is a very real risk, and it is a very real complication. If there was an infection, a lot of times we'll have to actually remove the implant, remove the entire device, and put a new one in while giving you antibiotics. So it could be another surgery if there was an infection. However, again, it's about a 1% chance, so relatively low risk for infection. Does the penile implant work? A very important question. The short answer is yes. Satisfaction rates from studies that have been done polling patients is about a 97% satisfaction rate, really anywhere between 95 to 98% depending on what study you look at. But satisfaction rates are very high. So what will your partner think after the surgery? What will your partner think after you've recovered and you're able to use the penile implant? Well, studies have actually shown that the partners are very, very satisfied after the penile implant, anywhere from 95 to 98%. So it's a similar satisfaction rate that we saw in those studies, those same studies that looked at the patient getting the penile implant. Those studies have also shown that the partners are extremely satisfied after the penile implant. So it's not only a good treatment for erectile dysfunction for the person with the erectile dysfunction, but also for their partners. Now, probably the most common question that we hear when people come into our clinic is, Doc, will you be able to make my penis bigger? Or will my penis be the same size as it was before? Or am I going to lose length? I didn't have very much before, so I want the most that I can get. Well, the answer is that we can give you what you have. We're not going to give you any more than what you've had in the past. Basically, we're going to put the penis complete stretch when we do the measurements to put in the penile implant. So we're going to stretch it out completely. We're even going to give you a little bit of an extra size in the implant. So we're going to gently oversize the implant, not enough that it's dangerous, but just enough to kind of give you the maximum length we can possibly give you. Now, that's not to say that the size after surgery is going to be the same as the size when you were younger, before you had erectile dysfunction. Just with the very nature of erectile dysfunction, your penis starts to shrink a little bit. Some of the cells, if they're not getting enough blood flow with erectile dysfunction, you start to get some scarring. You start to get some of those cells kind of retracting back. So you're not going to get the same size as you did before the erectile dysfunction. However, there are tricks we can do to kind of give you some of that length back. The biggest thing we're going to want you to do is use a vacuum erectile device. And that's something for another video in the future, just because we could talk a lot about a vacuum erectile device. But we're going to want you to use that before surgery. That'll help you get some of that length back, get some of the blood flow to the penis to get that tissue healthy, give you the best possible results following the surgery. So yes, you will be able to go back to normal from before your surgery. You'll be able to do everything you did before surgery after the surgery. After that first 4 to 6 weeks, complete total recovery time, we're going to give you the all clear to do everything you want to do. That's ride bikes, have sex, swim, ride motorcycles, ride horses, anything you can think of you're going to be able to do. Anything you did before surgery, you'll be able to do afterwards. If you work out a lot, if you do a lot of biking, if you do a lot of running, it won't have any effect on any of that. However, for that first 4 to 6 weeks, you do have to be a little bit careful. So we don't want you lifting anything heavy for that first 4 to 6 weeks or swimming in swimming pools, things like that. But after that time, you will be completely clear. You won't have any kind of restrictions whatsoever. So how long does the surgery take? When will I get to go home? Very valid questions. The surgery is relatively quick. It takes about 35 to 45 minutes for a very uncomplicated penile implant. Now, if you have any curvatures or things like that, it may take a little bit longer, but on average about 35 to 45 minutes. So it's a relatively fast procedure. Like I said, we do it through a very small incision, about 4 centimeters in length, underneath the penis, between the penis and the scrotum, so you're not actually even able to see the incision. It's very minimally invasive surgery. So it takes about 45 minutes at most to do a very run-of-the-mill penile implant surgery. Now, after the surgery, you will get to go home the same day. So that's one of the great things about the procedure. You don't have to stay in the hospital overnight. You'll get to go home the same day. So will my penis look different after the penile implant surgery? The answer is no. Nobody's really going to be able to tell that you have a penile implant unless they're really feeling around down in the scrotum. But people in the locker room, nobody's really going to be able to tell. Everything's underneath the skin. Everything's completely concealed within the body. Whenever it's deflated, nobody's going to be able to tell that there's a penile implant in place. So don't worry about it. Even if you're in the gym, in the locker room, nobody will know. So one question that we hear a lot, especially in patients that can sometimes get a natural or spontaneous erection, is after the surgery, will I be able to get spontaneous erections? Or if I get the penile implant removed, will my spontaneous erections ever come back? The answer to that is no. Because of where the penile implant is placed inside of the penis, that tissue that is responsible for your erections is actually displaced. So it's not really functioning anymore. So after you have a penile implant, there's no really going back. However, if you're at the point where you need a penile implant, there's likely not going to be anything else that's going to work for you anyway, or the treatments that are available are very cumbersome or not spontaneous enough for you anyway. So really, once you get a penile implant, you are dependent on the penile implant to get erections. So how does the penile implant work? How does the mechanics of the implant work? We get this question a lot just in patients who are just curious. They want to know what to expect after surgery, how to activate the device, how to pump it up, how to deflate the device. And then they just want to know what is going into their body. So it's actually very simple. I have a device here. So here is the penile implant. This is the Boston Scientific one, the AMS 700CX. So how it works is these are the two cylinders. These are kind of what go inside of the penis, and these are what we measure. They come in different sizes. So these are the two cylinders, and that's what gets hard and gives you the erection in the penis. Here is the pump. This is what you have to pump up to actually pump up the penis and get an erection. And then here's the button right here to release the erection. and then this is the reservoir. So this reservoir is what goes up in the belly, underneath the muscle, goes up in the abdomen. So it's all concealed, all underneath the muscle. You're not going to be able to feel it from the outside. And all of these parts are actually put in through that same small 4-centimeter incision. But how this works is this holds all the saline, this holds all the fluid. So whenever you pump this pump up, the saline moves from the reservoir here into the cylinders to increase the pressure within the cylinders and give you a hard erection. Now, once you're done, it takes about 10 to 20 pumps to pump it all the way up, especially if you're pumping all the way down. Once you're done, you push this button right here. I don't know if you can see it right there. You push that button and you can squeeze the penis at the same time, and all of that fluid moves back from these cylinders, back through the pump and back up to the reservoir to make sure your erection goes down. Now, after you've deflated the device completely, give the pump just one squeeze real quick. That locks the valve, prevents any fluid from going back from the reservoir back into these cylinders, just prevents it from inflating, auto-inflating throughout the day. So a question that we usually get after we've gone through all of the algorithm for treating erectile dysfunction, we've talked about the pills, we've talked about the injections, we've talked about the next steps, is, am I a good candidate for the penile implant? What makes a good candidate for the penile implant? Who gets the penile implant? The answer is anybody who really wants a penile implant is usually able to get a penile implant. If the pills aren't working for you, or if they have side effects that you just don't like, or if the injections aren't working, or they're painful, or not spontaneous enough for you, then the penile implant can be a good option. Now, we do need to make sure that you're healthy enough to go under things like anesthesia and come off any blood thinners that you're on for the surgery, but the vast majority of people are a good candidate for the penile implant. All right, guys, that's the end of the video. Thank you guys for sticking with me as we went through the most commonly asked questions for patients coming into our clinic considering the penile implant or just wanting to learn more about the penile implant. This should give you a good kind of basis and groundwork for you to work with your physician to talk more about the penile implant. If you guys have any other questions, just leave them in the comment below and we'll get to them in a future video. Thank you all for listening. We'll see you next time.